Hello, everyone. Welcome to our panel sponsored by BioMarin called Making Space for Tough Conversations in Achondroplasia. Today, I'm joined by three amazing panelists. Kate McLeod, she's a teacher, a parent to her sweet daughter Nora, who has achondroplasia, and a dwarfism awareness advocate. Dr. Christina Jacobson is the assistant professor of pediatrics at Harvard Medical School and the director of the bone health program at Boston Children's Hospital. And Dr. Jen Arnold is a pediatrician and neonatologist, as well as a mom to two kiddos with achondroplasia. Achondroplasia is the most common form of short-limbed dwarfism. It occurs in about 1 in 15 to 25,000 live births worldwide. It can affect the overall quality of health of individuals born, and 80% of individuals are born to average height parents. Today we're here to shed light on the lived experiences of those with or caring for an individual with a rare condition, navigating those tough conversations at diagnosis, treatment, and beyond, especially for the parents of infants and children who are newly diagnosed. We are also here to improve awareness and discussing possible resources while underscoring the importance of advocacy in the community. My name is Kristen, and I am a woman living with dwarfism. I was born to average height parents. My brother is 6'4" and wears a size 13 shoe. When I was younger, there were not a lot of doctors who specialized in skeletal dysplasia, and it became quite an issue for my parents trying to travel and find a specialist who was able to deal with everything that I was having going on. At the end of the day, I chose to undergo limb lengthening, and that was viewed as not a good thing in my community. Thus, I was excluded and lived life. I lived an amazing life. It was in the face of adversity, but moved forward and did everything that an average kid would like to do. In adulthood, again, finding doctors was very challenging, and I ended up experiencing spinal stenosis, which is the compression of the spinal cord, and I was almost paralyzed. Thankfully, due to the community that I had developed advocating for individuals who chose to seek alternative medical options, I found a doctor in Florida who was able to save my ability to walk. And thus, that has influenced me to start my nonprofit organization, the Little Legs Big Heart Foundation. Kate, I would love to know what your experience has been like in supporting a child with achondroplasia.
I would definitely say that at the beginning of our experience, we were in the dark and we were not provided with resources that gave us any comfort. I was around 33 weeks pregnant when I had the longest ultrasound of my life, and I was brought into a nondescript doctor's office, and the doctor walked in and they said, "I'm so sorry." And I was sitting there with my child moving and kicking me, and they're saying, "Your child has achondroplasia. I am so sorry." They then said, "This is what achondroplasia is. A lot of parents cannot handle the medical side that comes with this. Would you like to terminate?" I had just been giving the diagnosis like a minute prior to that. So having that question asked when I had just had my baby shower, and I was so excited to bring my daughter into the world, broke my heart because I was not told all of the amazing things that my child was going to be able to do. I was told all the things that she was not going to be able to do. And if I could go back to that mom and show her my child who can jump and skip and play and sing and count to 10 in Spanish at 2 years old, I would have felt so much comfort. But I was given this information, given a number for a geneticist, told that I need an MRI, and ushered out the back door of the doctor's office that I was at, and I sat in my car and just cried. This was my first baby. I did not know what to do. I was not provided with any resources to give me any comfort.
Dr. Jacobson, what about Kate's experience is surprising to you based on what you've experienced in your medical practice? And is there anything you'd like to add based on what you've seen or experienced?
Yeah, I'd like to say that it was terribly surprising, and unfortunately, I don't think that's the case. I've had several patients who unfortunately have had similar experiences. So achondroplasia is most commonly diagnosed in the third trimester if it's diagnosed prenatally. That is when most of the growth of the fetus occurs. It's not typically diagnosed on the standard 18 to 20 week ultrasound that most pregnant women have. And because it is diagnosed relatively late in pregnancy, this is the kind of thing that does occur. And because many providers are relatively unfamiliar with this diagnosis, oftentimes the kind of information that parents are given is very similar to this, which is very unfortunate. The vast majority of patients with achondroplasia do extremely well. They live very wonderful, long, happy lives. And if you go to an organization like the Little People of America, where approximately 80% of members have achondroplasia, you will see multiple generation families there, grandparents, parents, children, all of whom have achondroplasia and are living very rewarding, wonderful lives. And when I am counseling a woman who is pregnant, or whether I'm counseling parents of a newborn, that's the information that I want to give them. Are there challenges? Absolutely. Do patients have spinal stenosis and require multiple surgeries? Absolutely. And you want to give people a clear picture of what life's going to be like, but you also want to leave them with the fact that their child can live a long, happy life.
Dr. Arnold, you're a mom and you're also an individual with skeletal dysplasia, and both of your kiddos have achondroplasia. You have a very unique experience also being a doctor. What can you tell us?
So I think, when I was growing up as a person with skeletal dysplasia, my parents did not know what my diagnosis was until about the age of 2. This was many years ago now. And the doctors knew something was wrong, but they didn't know what it was. And my parents, I think, sort of had to grapple with a lack of knowing what it was that their daughter had. But at the same time, I think that helped to empower them to say, well, I don't care what is going on with my daughter. We're going to support her to have the best life possible. And so I feel like my entire life, again, like many other little people, being born to a family with no other little people in our family, my parents raised me to essentially achieve whatever it is I wanted in life. And for me, I really wanted to give back to kids. I had about 40 orthopedic surgeries growing up. So, my lower legs and my back and my spine, and my type of skeletal dysplasia, has a lot of those orthopedic complications. But I also knew that I didn't want that to get in the way of leading the life that I wanted, that I felt that I deserved. I'm sort of that girl who likes to have her cake and eat it too. And so I was fortunate to be raised to achieve those goals. And now, what I'm realizing as a physician is that it's not a given for people to understand the value and the quality of life that individuals with skeletal dysplasias have. I will say that in one of my first meetings as an attending neonatologist, I sat in a conference room of colleagues with a child who had a fetus who had been diagnosed with skeletal dysplasia of unknown etiology, and the things that I heard were devastating to me. And I thought, I was a new faculty member, and I thought, don't you see me sitting right here while you're saying these things about another, unborn child with skeletal dysplasia? It just was not done with professionalism or sensitivity. And I thought, we can do better as a field. We're in the business of caring for kids with, and babies who have unique and rare, genetic syndromes. And so it became sort of my goal to hopefully help raise that awareness. And now I continue to do that, or I did that for a while with a television show as an aside, nothing I planned on doing in my life. But again, I knew that the world doesn't yet understand what it's like to be a little person, and that life is very good. And so Now that's why I love what I do as a physician, being able to give back to kids and hopefully help parents who are navigating this new news in a more supportive way of, what does it mean to have a child with skeletal dysplasia? And then I have 2 kids. So when I became or wanted to become a parent, my husband and I both knew that we wanted a little person. And so we decided to go down the path of adoption and sought out another child with skeletal dysplasia. And so we were very fortunate to have 2 kids, and now I'm navigating the world of achondroplasia, which has differences in some of the complexities that my skeletal dysplasia has, but we also have a lot in common. And really, that's the potential for a very happy, full life.
Amazing. And I guess I have a question for all of you. What do you wish people knew and better understood about achondroplasia?
I wish people knew that people with achondroplasia are capable. I mean, look at Dr. Arnold, look at Kristen. Like, if I had seen these women when I received Nora's diagnosis, I wouldn't have had to take a week off work because I was so devastated by the information that was given to me, thinking that my child is not going to be successful. So just being able to share with these new parents that your child will have roadblocks, but they'll be successful. I mean, look at these women, it's amazing.
Dr. Jacobson, what do you wish people knew and better understood from a medical standpoint?
Yeah, I think that my thought is similar to that. I think for parents, I would like to say that as with any medical diagnosis, there will be challenges. There are always challenges, but these are challenges that together we can work as a medical team with you as a parent to overcome, and that your child can still have a very long, happy life. And there are excellent role models in the achondroplasia world for your child to follow, and we can work together to make your child have the very best life possible.
Thank you guys so much for sharing your hearts. I appreciate that. Dr. Arnold, do you have something to add?
So, I just want to say I echo everything that's been said. I think the one thing that I want, just the general public to know about individuals with achondroplasia is that we also don't deserve to be made fun of. And I think, unfortunately, all too often in a world where, we're looking to pick on others, a lot of times those who are little people are the lowest common denominator, and often are the brunt of mockery. And so I think it's important to realize the impacts of that sort of social stigmatization on kids that are trying to grow up and thrive and develop their self-confidence and, essentially just be kids. And these types of situations do impact others. And so I hope that all of us can sort of, help to decrease the making fun of, the ableism, in as much as we can, because it makes the world a better place and it supports all of us to be kinder to each other.
Yes, thank you. Thank you for saying that, because, as a child growing up with achondroplasia, it was something that I truly struggled with, but no one else really understood, since I didn't really have a community of individuals with skeletal dysplasia. But it's also something that I still deal with as a grown woman, and awareness is hugely important. Thank you all for sharing your personal experiences, and I'm excited to dive in more and understand how all of you have navigated some of the complex discussions. Kate, can you talk to us about some of the challenging conversations you've been confronted with since Nora's diagnosis?
Yes. I feel like I have 2 different sections of tough conversations that I have. The first is with the medical community. I'll go to a doctor and say, how many patients with achondroplasia have you seen? And where I live, they'll be like, maybe 1 in my whole time working. And as a mom, I'm like, okay, that's a little scary. So having to have those conversations with doctors who aren't experts and feel hesitant working with my daughter is tough. So I have to constantly be reaching out to doctors who work with those with skeletal dysplasia so I can make sure that my daughter's getting the best care. So conversations with doctors where I feel like I should be able to put 100% of trust in them is difficult as a parent. She's my first child. I'm not in the medical field. I don't know where to go for her. And then on the other side of that, just conversations with average height people, and I have people come up to me all the time, is your child a midget? Having to educate people about their language choices, and why would you ask someone that question about their appearance has been really tricky. But I feel like as an educator, it's important for me to teach people that it's not right to use the word normal. We like to use average height or little person, so I feel like I just take it upon myself because Nora is 2, and she can't teach people those things. So I like to step in and have those tough conversations, even with strangers in the grocery store. I'm willing to do that.
Amen. And we all know that there are some very differing views within the dwarfism community surrounding the change in landscape around treatment options that have arisen. And Dr. Arnold, I'm wondering, can you discuss the importance of shared decision-making between families and their care teams, and why open communication is just so important?
Yeah, I mean, I think for anyone who's seeking care, you want to have the most information possible in a meaningful way that you can understand, so that you as an individual can make the best decisions, whether that's care for yourself or care for your child, someone that you love. And I think all too often, the medical field, we have a lot of terminology, it gets very complex, and we forget to check in. And so the ability to essentially, when you're having a conversation about treatment options, to say, I have as much to learn from you, my patient, as you have to learn from me, is the best way in my mind to approach it, because then it's shared education. Because I have no idea as a caregiver what's important to that family, that individual. What does quality of life mean for them? What does treatment options mean to them? And in turn, it's my job to be able to explain to them, all of the pros and the cons of any treatment options in a way that they can understand, and ensure that we're on the same page, so that then I can be supportive and helping make those decisions that are in the best interest of that individual and that family. I also do a lot of teaching in my job in simulation, and we spend a lot of time training clinicians on how to have these, quote unquote, difficult conversations, because in medical school, you don't necessarily get much training, if any, in how to do this. And yet, this is the number one, probably most important part of our job, is to be able to explain diagnoses and treatments and create that shared decision making, so that each family can make the decision that's optimal for them, with all of the knowledge that they need to be able to do that in an informed, autonomous way.
If I can just add to that, I just want to really emphasize that and say that I have learned a great deal from the skeletal dysplasia community and from families. When I go to some of the advocacy group meetings, they've been very generous on letting me sit in and listen to the families talk. And I realize as a caregiver, as somebody who's as a physician, patients come and they meet me in my office, and oftentimes they put on a little bit of a happy face when they're meeting with me, and they don't always talk about some of the issues that are really in their life and bothering them. And it's made me a better provider to try to think about, am I really getting down at the issues and the problems in their life? And am I really asking them about the things, simple things like, do you have the functional things that you need at school so that your child can reach the sinks? Do you have everything that you need for toileting at home? Things like that in my life that I don't always think about in the 20 minutes that I have to see a patient or whatever. Do you have is it difficult for your child in a parking lot because they're shorter and you're worried that a car is going to back into them? Just things like that as a physician you don't always think about when you're checking off your boxes about, do you have the medications that you need? Do you have these kinds of things? Developmentally, how's your child doing? And working with families has really taught me about those kinds of things, so that I feel like maybe we're establishing a little bit more of a care team then if I'm sitting there checking off my boxes in my head about, am I doing the things that I need to do as a physician? And I really appreciate the patients and the families for sharing those kinds of things with me.
So knowing that this is such a sensitive topic, how do you as a healthcare professional start the conversation around treatment options with individuals and their families?
Yeah, that's a great thing. So, I feel like my job as a healthcare provider is to let the families know that there are treatment options out there. I'm happy to discuss with them the treatment options that are available, what they are, what the side effects are, and what the benefits and risks are for each family. We take it from there. And if the families say we're not interested at this time, that is completely fine. I would never push it on a family. If the families say we want to know more, then we discuss more and we go from there.
So Kate, with Nora, what has your experience been in looking into some of these treatment options as a parent?
As a parent, I feel like I learned the most from the little people community. I didn't know about some of the treatment options until I spoke with other families about them. So then taking that information from those families, doing my own research, and then going to my provider and talking with them about what's best for Nora has kind of been the path that we've taken. Like, we just start with our little people community and then bring it to the doctors from there.
And what were some of the biggest considerations that you had to take into account in deciding whether or not to pursue treatment?
I mean, as you know, it's no surprise that the world is not built for little people. And I want to give Nora the best chance that she has to have a quality of life where she can be successful. And when I look at treatment, my husband and I just look at what will give Nora the best quality of life and make her an independent girl, because she is an independent girl. She's going to need that growing up. So then we just take that to our doctors and have those conversations about pros and cons and go from there.
And Dr. Jacobson, how do you approach some of these sensitive conversations with families who have differing views?
Absolutely. So like I say, my job is to offer it to everyone, and the families will let me know really quick if they're interested or not. If they are not interested, I get shut down pretty quickly, and that's fine. That's totally fine. I make it very clear that if they are not interested, it's not going to affect our caregiver relationship whatsoever. I make a note of it, and it doesn't have to come up again. If the family is somewhat interested, we discuss it a little bit, and if they decide they don't want to pursue it, totally fine. If they, decide they want to pursue it, sometimes they'll come in and ask me about it directly before it even comes up in our conversation. Absolutely fine. We pursue it.
Dr. Arnold, do you have anything to add to that?
I mean, I think the only thing to add is that what's really, I think, helpful for me when we have these difficult conversations is it's about making that relationship with the family and sort of, just being fully transparent and honest. My role is to help inform, share options, and hopefully help you make the decision that's right for you. But having that relationship is really key, because there needs to be trust there in any situation, whether a family pursues one treatment or another or not. And so I think it's really creating that relationship, because at the end of the day, we're all humans, and every parent's trying to make the best decision that they can for their child. So, my goal is just to help them feel confident that, I know that and that I support that. And my goal is just to help them in any way that I can.
So, Kate, how do you feel that clinical teams can best support you as a parent and other families who are looking into these options?
I think just getting the information out there for us parents. Like, we find ourselves a lot on social media, reading about things or having those discussions, because it's not often I can get together with a family that has a child with achondroplasia. It takes a lot of planning and time and money for us to all get together. So spreading that awareness online, I think, is the easiest and fastest and best way for us parents to get the information that we need.
Yeah. Community, for sure, is everything. And that is the beauty of social media these days, is that you can have the community on the screen, but I think it's also super important off screen as well. And there are a few different organizations here in the U.S. that provide support to individuals and their families who live with achondroplasia. Looking forward, I want to close out by asking a couple of things. First, How would you like to see support, resources, and awareness evolve as the landscape advances for individuals living with achondroplasia?
Everyone's looking at me. Okay. So how would I like to see them evolve? Like the resources and...
How can resources better serve the
Yeah.
community?
Yeah, I think resources need to, number one, my hope is that they become more accessible and that everyone knows about them, right? So resources are only good if you know about them and where to go for them. So I think that's first and foremost. I've still run into families that, haven't had, aren't aware of this, groups like Little People of America, or what centers have clinicians that specialize in skeletal dysplasias. And so I think the resources need to be more accessible. It will be my first. And then I think my second goal, if I could just pick one other one, is that we really do realize the value in providing comprehensive care for individuals with skeletal dysplasias, like any other rare disease. I know the numbers are small when you compare it to other disease states like high blood pressure or cancer, but yet if we don't provide care, for those individuals, then all of the other aspects of their care start to falter, right? So when I had cancer, my cancer care depended on certain aspects of me being a little person. And so if we want to provide care for individuals, we have to start to provide care for every aspect of that individual, and that includes the things that make them unique, and in our case, skeletal dysplasia.
And I just know as a parent that I wish that there were resources when I received Nora's diagnosis, that I could have gone and learned about Little People of America, or learned what baby carrier I could use for Nora, or what crib I could use, because it's different than an average height baby. And I didn't know that, especially as a first-time mom. So I've made it a point I made a website to educate new parents about dwarfism and resources they can use for their child and ways to get connected. And I've put myself on TikTok, which is not really my vibe, but I've gotten out there and tried to teach people about the correct terminology. And I have moms message me weekly. I just got this diagnosis. I am terrified. How can you help me? And if I had just had something that could have given me more information when I received that diagnosis, it would have been an easier path for me.
Yeah, I would say that if I had my wish, it would be that we live in Boston. There are many, many care providers here. There are excellent experts in a lot of care. I do worry about people who don't live where there are centers of care. So I grew up on the West Coast, and if you live in Alaska, for example, there's no, you have to fly to Seattle to get this kind of level care. If you live in Montana, there's really nobody around. You've got to travel almost to Seattle or someplace. And I will also say that as pediatricians, there are excellent pediatric centers for skeletal dysplasia care. It's a lot harder in the adult world, as I'm sure my colleagues here will tell you. To find an adult surgeon can be very difficult who specializes in skeletal dysplasias. So people who have skeletal dysplasias live into adulthood and have adult complications, and it would be wonderful if we had adult providers who were experts in their care.
Dr. Arnold, if you could give one piece of advice to people living with achondroplasia or skeletal dysplasia who feel like they've been underestimated, what would you say?
So I think for those that are feeling underestimated, my advice is don't give up. I mean, that may sound a little cliche, but it's true. Because honestly, this was sort of advice that my parents used to give me. If I let all of the adversity or the obstacles in my way, essentially paralyze me from, doing the things that I want to do, then the only person that's suffering is me. And so it sucks, and we're going to have days where life sucks, and you're going to have to, kind of pull your chin up. But in the end, the days that are great much more outweigh the days that aren't so great. And so we have to figure out a way just to keep going so that, as like I said before, you can be that person to have your cake and eat it too.
Dr. Jacobson, what advice would you give to other medical professionals who are seeing the diagnosis of achondroplasia moving forward?
Well, first of all, you're lucky because people with achondroplasia are great. And second of all, I would say have the highest expectations for your patients with achondroplasia. They are going to do really well. And again, most patients with achondroplasia do very, very well, and they live wonderful lives. And most patients have relatively few medical complications, especially in pediatrics.
Kate, anything to add as a fierce mama bear and advocate?
Fight for your child, find them the best medical care that you are able to. Find friends in the community because they help so much. And don't give up. You are not alone in this. In that instance, when I was in that doctor's office, being told I'm sorry, I felt incredibly alone. But look at where I am now. I'm not alone.
Love it. Thank you guys so much for your vulnerability and sharing your hearts.
Thank you.